Huh? Mm-mm.
So yesterday, I woke up in pain, the same spot. I've herniated this.
Oh, that sucks.
And I
Yeah.
didn't MRI on Thursday.
I feel your pain. Like I have sciatica and like I'd said before, like 90% of sciatica cases are caused by herniated discs. So I probably have a herniated disc. I haven't had it diagnosed yet. I mean, all that they can do for it really is like, physical therapy to strengthen your muscles in the area. Um, until it gets like bad enough that it needs surgery, but like they don't like to do surgery for it. Yeah.
But it's hereditary, so I get it from my dad.
Yeah. And you're young to have that issue too.
Yeah.
My aunt just had to have surgery for it. Oh,
He's not in front of me. I said, he's tall. He's heavy, he's big.
yeah.
And his back started to tear.
Mhm.
Walk like a slant.
Mhm.
It was all on the side.
Yeah, man. It's the type of pain that like you can force yourself through it, but you know how much pain you're in. It's taxing, man. And like I think a lot of people don't get like how bad that pain can get sometimes. And
It hurts so bad. I put screw it to drive, but I had to hold on to the side when I turned.
Mhm.
Even slightly.
Yeah, yeah.
I like my back.
That sucks. Yeah, I mean, you're pretty young for that to start happening. So it's one of those things that it's only going to get worse the older that you get. Like, that's the hardest part of it. Mhm. Mhm.
So of course, that's like the only thing about him.
Right.
My mom, and one thing that excruciating pain.
Mhm. Thanks, Dad. Um, well, this week I'll be there tomorrow from 2:30 to 4:30. I won't be there on Thursday. I have like too many other meetings I have to go to on Thursday. So, yeah, Mondays. Typically it's going to be Mondays and Thursdays. So next week it'll be Monday and Thursday.
I'm trying to figure out when I can do it and somehow.
Yeah. Yeah, that's the hardest part with it. And this week I have professional development. It's professional development week. And so they're having like all these meetings. Like that's why my schedule is so messed up and why I keep being like, hey, I'm not going to be there this day. Or like these days things get moved around because of meetings that they're having for professional development week. But that's only this week. Next week, everything should be back to.
Like professional development makes no difference.
Yeah.
Maybe this is We have meetings, but we have to be there until 3:10.
Yeah. Yeah, ours is, we don't get that lucky, right? They just have them like randomly throughout the day and you just have to make it to a certain number of them. And so it's tough because I have to use office hours or whatever. And then it's just, and then with me trying to be in the STEM lab, it's just impossible.
Working in the summer?
Yes. Yeah, I'm gonna teach one section over the summer. And so it's hybrid. And it's all in 8 weeks, you know, so yeah, it's not bad when people only take one class, but I have some students that like think that, oh, it'll be manageable. I can take two. They're not used, you know how it is. You take this class, it's a lot of work, but people weren't expecting it to be this much work. But in 8 weeks, yeah, cramming it all into 8 weeks is like, we meet and lab is every single day. So it's like Monday, Tuesday, Wednesday, Thursday. And so that's why I only teach one section of it in the summers, because like I can't even handle like more than one section in the summer. And it's hard. But yeah, there's a month cushion on either side of it, so it's not so bad. Well, about a month. No, it's not bad. I think summer classes start the first week of June. And it's all of June and July, and then whatever day classes start on August. 20. This will be 21. We'll do 21. This will be 20. 21 will be on Thursday. Yes. The Hoot will be 19. It will be chapter 19. I'm just waiting to let people trickle in. We're gonna start it at 5:50. 1, 2, 3, 4. What'd you say? That's yeah.
Like it was a baby squirrel, my dog attacked it, dropped it out, and it injured its leg. So I was holding him, and he started like biting me, and I was pulling him away, so I was holding him like this, and he went to me. And
Yeah.
I was for a good like hour, like, or not, it was pretty close to an hour, I was calling everyone.
Yeah, see who could take care of it. Yeah.
Okay, and right when they showed up, they died.
Oh, that's the worst. That's what I'm always afraid of with possums that get in our yard. I'm always afraid that like I'm gonna call somebody to come pick it up or rescue it or whatever, and then by the time they're gonna get there, it'll be dead. Because we can only ever find people that'll come get it. Like we had a lady drive all the way out from Weatherford one time to come pick up a possum that we found in our yard. We find them every year. There'll be baby possums.
Possum in their apartment, and animal control took it in there.
Oh yeah.
You have to get like an okay from it.
Yeah.
Or whatever.
I've seen people like on Instagram and stuff that have possums as pets. They don't live very long. They only live like 3 or 4 years, I think. And they are pretty smart. I think they're somewhat trainable. I think you can even train them to potentially, like if you work on train them to use like litter boxes and stuff like that. But
my friend Megan has one. She also has one. Has a raccoon.
That'd be a handful.
So I was trying to get her. She was working. It was funny, she's a dispatcher.
Yeah.
So I called 911, couldn't get her call.
Yeah.
I ended up answering. So I told her where I was, and she's like, "Oh, are you Kelsey?" I'm like, "Yeah." She's like, "Oh, so and so." And I was like, "Oh my gosh, sorry, knocked on your door." She's like, it's still pregnant. I was so sad. My finger still hurts. I mean, I have my rabies shot. But got me pretty good.
All right, guys, we're going to make sure that you're signed in on the Kahoot in case it kicked you out or something. We're going to get started with that. All right, let's get going. Evening classes, man. It's always a better bunch to talk to, but it's like hard. It's hard late in the day. I know how you guys feel, just trust me. All right. Which skin disease is Staphylococcus aureus a common cause of? So this one is going to be impetigo. So impetigo is commonly caused by Staphylococcus aureus or Streptococcus pyogenes. So strep that causes strep throat, Streptococcus pyogenes. Scarlet fever is associated with Streptococcus pyogenes. Fifth's disease is caused by a virus, and gas gangrene is caused by Clostridium perfringens. All right, true or false? Scarlet fever is caused by the measles virus. I did just say it. Let's see how many of you guys were paying attention. Right? So scarlet fever is usually when you develop a rash associated with the strep infection. So it's not going to be measles, by the way. But yeah, so this one's going to be false. Scarlet fever is associated with Streptococcus pyogenes. And so what happens is you'll get strep throat. And like what you'll see is like with little kids, oftentimes when they're little, they get strep throat. They'll also get a rash on their body. That rash is scarlet fever. That's what that is. So it's when it basically spreads beyond just the throat and we start having more of the body reacting. All right. What aspect of Clostridium perfringens causes production of gas in infected deep tissue? So there's a hint here. It's in the deep tissue part. It creates a certain sort of situation. All right. In the deep tissues, we are basically safe away from oxygen exposure, and Clostridium species, all of them are anaerobic. They can't handle being in the oxygen. So the anaerobic aspect of that environment allows them to become vegetative and produce their toxins, allowing them to form gas gangrene. All right, question 4, true or false? Chickenpox is caused by a herpes virus. Alrighty, so this one is true. Chickenpox is caused by a virus that we call varicella zoster. It's also known as human herpes virus 3. It is a herpes virus. It hides away in your nerves, kind of related to some of the stuff we're going to talk about today, which are our nervous system diseases. Smallpox is caused by vaccinia poxvirus. Is this true or false? So these questions aren't dissimilar to questions like you'll see on the exam. The exam might not have as many true falses, right? But it might have something like, which of the following is the cause of smallpox? And then this might be one of the possible choices. So smallpox is caused by a virus called variola. Vaccinia causes cowpox. We use that to create the vaccine against smallpox because they're similar, but they are different viruses. All right, what type of pathogen causes measles? Again, this type of a question will be common on the Unit 4 portion of the exam. Hey, I should have had an energy drink. I'm exhausted. All right, so measles is caused by a virus. Most of us knew this one, so good job, guys. Next question. What type of pathogen causes ringworm? Ready? So ringworm, most of us got this one too, is caused by a fungus. They're known as dermatophytes, and the disease ringworm is also known as a cutaneous mycosis. Your patient has red eye, their eyes are red and inflamed. They have photophobia and milky yellowish discharge. What would you diagnose that as? From our choices here. Yeah, so this one's going to be conjunctivitis for sure, but the fact that it's milky yellow discharge, we know it's bacterial. In viral conjunctivitis, you'll have just clear discharge. All right, question number 9. What is the most common infectious cause of blindness worldwide? Which microbe is responsible for it? All right, so this one is chlamydia trachomatis, also responsible for the sexually transmitted version of chlamydia. It causes scarring of the eyelids, those scar the retina, and that leads to blindness. This is our last question. Which type of organism causes river blindness? So this one is helminth. This is caused by an actual roundworm. The worms being the parasitic cause of this. So parasite will refer to typically in our infectious diseases, either protozoa or helminth, and this happens to be a helminth one. Keep in mind that protozoa are always going to be single cell organisms, and when you have worms, those are going to be helminths. Harkens back to chapter 5. All right, excellent work, everybody. We're going to jump into chapter 20 from here. Does anybody have any questions before we start that? Okay. So chapter 20, we're going to get into the diseases of the nervous system. First, we have to understand the nervous system. Nervous system will consist of the central nervous system, which is just your brain and your spine, and then our peripheral nerves, the nerves that branch off of those, and then move into our extremities. The brain and the spinal cord are protected by bone. The skull itself is protecting the brain, and the spinal cord is protected by our vertebrae. And then we also have the central nervous system, including the brain, surrounded by a 3-layer meninges. The meninges is the covering that surrounds the central nervous system. The meninges consists of the 3 layers, the dura mater, the arachnoid matter, and the pia mater, which I will not test you on, but you will need to know for when you guys take anatomy. Cerebrospinal fluid is the fluid that fills any of the space between the tissues of the nervous system. We call that the subarachnoid space, especially around the skull. This is clear serum-like fluid that provides nutrients to the central nervous system and also provides a cushion for any like trauma impact of any kind. The 3-layer covering, that meninges, if it becomes inflamed, we call that meningitis. In our class, we're referring to the inflammation being caused by infection, but you could potentially have inflammation of the meninges, leading to meningitis caused by like trauma or something like that. For our purposes, it'll be caused by infection. The literal word meningitis means inflammation of the meninges, though. So that could potentially be caused by things other than infection. Yeah, it's pretty rough. It's one of those things that'll have you like worry and you're not going to make it type of an illness. All right, so our defenses of our nervous system. We have the bony casings for protection as well as the CSF cushion. We also have the blood-brain barrier. The blood-brain barrier consists of cells that basically making up the blood vessels within the feeding into the brain and the central nervous system, and that those are going to be more selective about what can cross that barrier. Whereas in other tissues, we can have molecules and things and white blood cells and things like that crossing over much more freely from the bloodstream and into the tissues. In the central nervous system, this is like controlled a lot more. It's prohibited. So it should prohibit most microorganisms, but unfortunately, it also prohibits some drugs from crossing the blood-brain barrier, which means that if you get an infection in the central nervous system, it's sometimes hard for the drugs to cross over into those areas in order to treat the infections. All right. So basically, when we have an inflammatory response as part of the immune system responding to a pathogen, the inflammatory response kind of can cause damage to the tissues in the area. And so to protect from that causing permanent damage potentially in the central nervous system, we have a lowered effect of the immune response. So we have special cells. We have a decreased overall signaling. We have a decrease in the MHC molecules to present antigens. And we also have lower quantities of the complement proteins that are involved in the innate response. We have specialized cells in the central nervous system that work basically at a more muted effect than what the normal immune response would be. This would be the microglial cells and the brain macrophages that have phagocytic activity and also just don't signal as strongly. So not as much of a cytokine response from these guys signaling for, we can still get lymphocytes and things migrating into there, but they're not going to get that strong response signal. It's going to be much more muted. The central nervous system and the peripheral nervous system naturally don't have a biota. And this is actually going to be true of our blood and our lymph as well. They don't have a biota. So those are the only two parts of the body that we can say definitively shouldn't have a biota. They should be essentially sterile as far as microbes go. All right, let's get into our diseases. Meningitis, again, is inflammation of the meninges. We consider this an anatomical syndrome, which is defined by its signs and symptoms that are associated with the inflamed meninges. There are non-infectious causes of meningitis, but that's less common than the infectious versions. The worst kind of meningitis you can have is bacterial meningitis. So we're going to talk about 3 types of meningitis: bacterial, then fungal, then viral. And if you had to choose between the 3, you want viral meningitis. Most people will recover from that naturally, but bacterial meningitis is very potentially deadly. When you suspect somebody has meningitis, then your first step is going to be performing a lumbar puncture to collect the cerebrospinal fluid. And then you would do a gram stain directly on that cerebrospinal fluid. So this is going to start getting us to thinking a little bit in that meta regard when we start talking about this stuff. So regardless of what you think, this patient comes to you and they're having the symptoms of meningitis, which we're going to get to in a slide in a second. But they're having the symptoms associated with meningitis, and you think it's probably meningitis, you're going to start treatment with antibiotics immediately. You're not going to wait to find out if it's a virus or fungus or what kind of bacteria. You're just going to start on broad spectrum antibiotics. That's how serious this is, because the progression of the disease happens very quickly and can be very deadly and lead to, like, because it's in your brain, like this is the covering of your brain and can cause brain damage that can be permanent. So we want to be sure that we're trying to treat the worst kinds of this, which is the bacterial kinds, as soon as possible. So I told you guys, it's going to be bacterial, fungal, or viral. And there are some defining characteristics just in those groups, right? So if we were talking about bacterial meningitis, the cells will not have a nucleus or any membrane-bound structures. So keep in mind, bacteria, they still have DNA, but it's not bound in a membrane nucleus, right? And so if we do a gram stain on the cerebrospinal fluid, the CSF, and we see that there are cells that don't have nuclei, that's probably bacterial meningitis. If we see cells that have nuclei, it's probably fungal. And if we don't see cells, it's probably viral. And so that's the way that we will start predicting that. Oh, that sucks. A dog, you said? That really sucks. And it's not much we can do for animals, unfortunately, because they just don't get the same treatment.
Touch something.
Yeah.
And automatically something that you touch very like the best.
Yeah. So that we're going to talk a little bit about how like prevalent the bacteria is. There's actually the 2 most common bacterial kinds are like bacteria is everywhere. Like it's all over the place. It's just a matter of whether it gets into your meninges. So meningitis has the following signs and symptoms associated with it: photophobia, which is light sensitivity, headache, painful or stiff neck, fever, increased white blood cell count in the CSF, where we shouldn't be having any immune response because there shouldn't be pathogens there. And then certain microorganisms might have certain characteristics in addition to some of these symptoms. So we know that there's a certain kind of meningitis that has a rash associated with it. We call it petechial rash. And so if you get the spots where the little blood vessels start to burst under the skin, then it's a particular kind of meningitis caused by Neisseria meningitidis. Neisseria meningitidis is a bacterial meningitis. It's a bacteria that causes meningitis. We also call it the meningococcus. So if you've heard of meningococcal meningitis, that's this. It does have the petechial rash associated with it. It's caused by a gram-negative diplococcus, and they look like little butts all over the place. If we do a gram stain on this guy, he's gram-negative. What color would he be under the microscope if we did a gram stain? Anybody remember? Red. So he'd be red. So if we look at red little butts all over the place, that would indicate to us it's Neisseria meningitidis. These guys are responsible for about 14% of meningitis cases, which is pretty significant when we start thinking about the ratio of the meningitis cases. Anyways, Neisseria meningitidis is normally housed in the throat or in the sinus cavities, and then it will migrate into the nervous system under certain conditions. And so you can have this as part of your biome, and if you don't, and it gets introduced to you, it's most likely going to be able to take hold as a pathogen. But even from your own biome, if it has like lowered immune system, stress, or something like that, could potentially trigger it to be able to become a meningitis infection. If it does lead to an infection, Neisseria meningitidis can lead to meningococcemia, Meningococcemia, meningococcus in emia means in the blood. So this is when you get a blood infection from this guy. And this is where this gets the worst because we already said if this guy is gram negative, right, he has endotoxin. And endotoxin very strongly stimulates the immune response and the inflammatory response. It's a PAMP. And so our inflammatory response will get activated and lead to complement activation and all sorts of stuff, causing a lot of tissue damage. That's where we get the petechial rash from, is blood vessels bursting from all the inflammatory response to the endotoxin. And so when this happens in the bloodstream, this can cause devastating damage to the tissues and lead to necrosis, which is what we see with these kind of necrotic lesions on this little baby here. If you do get developing meningococcemia from the meningococcus bacteria, then your likelihood of dying is extremely high. We're talking like 80 to 90% if it develops to this stage. It's really hard to catch up with the infection once it gets to that level, even with antibiotics. All right, and the likelihood of you having like permanent damage, sequelae, is really high. All right, Streptococcus pneumoniae. Streptococcus pneumoniae is another bacteria that can cause meningitis. It is actually the most common cause of bacterial meningitis. This is also the most common cause of pneumonia. It's in the name, and you're right, it is in the name, and it does do that. So this is called the pneumococcus. And so you may have heard of pneumococcal pneumonia. There are vaccines that are available for this one. And again, extremely, extremely common in the biome. Most people carry this in like their throats and sinuses. So Streptococcus pneumoniae is associated with bacterial meningitis. This guy is a little bit different. This guy won't cause the petechial rash. And that's partly because the petechial rash is triggered by the endotoxin, but this guy doesn't have endotoxin. He is gram positive. And he, strepto, we're gonna have chains. It's usually end-to-end pairs. So we'll have like chains of pairs, so to speak. But this guy with the chains, because the strepto, already, if I did a gram stain, you would tell the difference immediately between the first guy and this guy. So gram positive, he would be purple in the gram stain. He's cockeyed, but he'll be in chains, not just in pairs. And so those are already some very defining characteristics in the gram stain just from looking at that. And that's why the number one first thing you're going to do for diagnosing this is going to be looking at the gram stain of the CSF. We don't have time to wait with these patients on PCR. In minutes, it's going to be life. So these guys do have a polysaccharide capsule that helps them evade phagocytosis, and they are alpha hemolytic, so they don't go full beta hemolytic. They don't have complete hemolysis here. On a blood auger, they would have a green zone around them. There are vaccines available for this. Next is Haemophilus influenzae, another cause of bacterial meningitis. This guy is a gram-negative coccobacillus. So this guy is an oval-shaped guy, and we're not going to have butt-shaped pairs on these either, so we can already tell this guy from the previous two in the gram stain. This one we usually shorten it to Hib because it's Haemophilus, H, influenzae, I, and then we will have B because it's serotype B. And there are vaccines available for this. There is a type A, but it's way less common. So we actually have a significant decrease in the Hib version of meningitis because the vaccine has become so widespread, especially in the elderly populations, like really pushed to get that vaccine. Our last bacterial contender is Listeria monocytogenes. So our previous guy is a gram-negative coccobacillus. This guy can be coccobacillus shaped as well, but he's gram positive. So we should be able to tell all four apart from one another with a gram stain by cell shape and whether it's gram positive or gram negative and their arrangements. So this is Listeria monocytogenes, or well, he's a bacterial, can cause meningitis, but he's usually more well known for foodborne illness. And so these guys are pretty resistant. They're resistant to cold, heat, salt, pH, and even bile. So they can get in through your GI system and then migrate through the GI system and into the nervous system from there. They actually move into the cells and can move around in your tissues through the cells. So these guys go into the cells. They are motile. They do have flagella. Most people will have a very mild or even subclinical presentation whenever they have this, but maybe just feel a little off. Symptoms can often be fever, diarrhea, and sore throat if you have symptoms. So most adults aren't going to get meningitis. Most adults are just going to clear this out just fine, have mild disease. But there's a problem. The problem is if it crosses the placental barrier, because these guys can actually move through the cells, placenta is no barrier for them. And so if they do cross the placental barrier, this can often lead to premature abortion of the fetus or death, even after birth, resulting from the infection. The death rate for babies that are affected this way is about 20%, so it's still pretty high. So it is something that we test for in food testing. This is associated with contaminated dairy, poultry, and meat. This is the reason why you're supposed to cook your lunch meats if you're pregnant. I'm sure you guys have heard that. You're supposed to heat up lunch meat. This is the risk there. Next is the neonatal and infant meningitis, kind of a category on its own. These guys are bacterial as well. They're usually associated with Streptococcus agalactiae and E. coli, which I won't test you on, but it's something important to know about in like the medical field, especially if you're planning on doing like a neonatal unit or something like that. But anyways, the Streptococcus agalactiae, which we're going to talk about later on in the reproductive tract section, is about 40% of women have it as part of their normal biome in the vagina. And so when the baby is exposed to it in the birth canal, it can become infected through the eyes and mouth. And then that can lead to the meningitis that can be extremely lethal or cause permanent defects for the baby. I have a student from last semester who had a baby that got this kind of strep infection from exposure during birth, and her kid ended up with permanent hearing loss. It was completely deaf. And they tried for like years to try to help the kid like overcome a lot of the disabilities that were associated with the strep, but he was having a lot of other birth defects associated, or not birth defects, but sequelae associated with recovering from this, and ended up dying as a result of some of the damage that was caused. So it's pretty serious. So that's it for the bacterial guys. Now let's shift into the fungi. The fungi typically are going to be associated with a more chronic presentation of the disease, but you might see acute meningitis in people who have immune compromised situations. So people with AIDS are more likely to get this version of meningitis. So the fungal meningitis, there's two of them. This one is more commonly associated with meningitis, and it is Cryptococcus neoformans. And so it's spread through bird droppings. And we see this a lot in homeless populations. Cryptococcal meningitis. Next is coccidioides, and it's usually the species most commonly associated with this is Coccidioides immitis. We really don't see it anywhere except for in the deep southwest of the United States. So we've seen 60% of the cases are going to be in like Arizona area and even southwest Arizona. And it's not usually associated with meningitis, but can potentially present that way. We call it valley fever, the disease it normally causes. That's really all I have to say about it. All right, viral meningitis. So we've done bacteria, we did the two fungi, and now we're in the viral guys. 4 out of 5 of all of meningitis cases are going to be caused by viruses. And so that's a pretty significant number. And most of those viruses, especially in children, if you get viral meningitis, most of the time it's going to be due to enteroviruses. So these are viruses that get in through ingestion and then move into the nervous system. And we might not think that that seems like a very common thing, except that's how polio used to cause its infections. You would ingest contaminated water and it would move into the nervous system from there. We'll talk about it soon. But viral meningitis is generally very mild compared to bacterial meningitis, and it usually resolves on its own in 2 weeks. We can treat it with antivirals, but we usually just let it run its course and just watch the patient while they are recovering. Mortality rate is less than 1% with viral meningitis. It'll feel pretty rough while you have it, but you're usually going to recover on your own. Some of the viral meningitis cases are associated with herpes viruses, not just herpes simplex virus 2, but potentially other herpes viruses like human herpes virus 3, which is varicella zoster, which is the cause of chickenpox. So keep in mind, 1 in 1,000 people who get chickenpox, which is actually a pretty good number when you consider how many people get chickenpox, 1 in 1,000 of them will have life-threatening complications like meningitis associated with it. So not something to be taken lightly. But we already know that herpes viruses move around in the nervous system. We know that about chickenpox for sure, because it hides out that way for shingles. But we know that about herpes in general when we think about genital herpes, because it'll hide out in the nerves and then come out when people who have it are stressed, and we'll get the vesicles that are associated with it can be very painful. Valtrex will keep that under control, but it's not 100% effective. And there's an issue with herpes viruses potentially during birth. If you're having an active outbreak of herpes virus, you are not allowed to give vaginal birth. Like, you must have a C-section. There isn't an option. It doesn't matter what your birth plan is. And if you were at home and you're having a herpes outbreak and your midwife lets you have vaginal birth, the problem is that if you get herpes to the baby gets exposed. Just having herpes as a baby, you have no immune response of your own. And so herpes in a baby, first of all, herpes is forever. There's no getting rid of it. So your baby has herpes from birth, number one. Number two, the mortality rate of babies, newborns, and with herpes virus that are just exposed to it is about 30%. But if it becomes meningitis, we're talking 80% fatality rate. That's not a risk that doctors are willing to take. And so it's actually required that you have C-section if you have an outbreak going on. If you're not having an outbreak, that risk is almost negligible. So as long as you're on your medications, that baby won't get exposed and it will be fine. All right, moving on. That's it for meningitis. We're going to talk about encephalitis next. Encephalitis is itis, inflammation of encephaly, which is the brain. Okay, so, but there's an in-between category, which is meningoencephalitis, where we kind of have both going on at the same time, all right? The guys that are the culprits for meningoencephalitis are amoebas. Amoebas are a type of protozoa, so single-celled eukaryotic organisms. And the two culprits here are going to be Naegleria fowleri and Acanthamoeba. Acanthamoeba we talked about with keratitis. And so keratitis, if it isn't treated or if it progresses and doesn't clear up on its own, can potentially become meningoencephalitis. We'll start with Naegleria fowleri. Naegleria fowleri is usually transmitted in warm waters. It's usually going to be associated with warm, like natural water, like ponds and lakes and things like that. And what happens is, like, people go swimming and it forces the water up into the nasal passages, and then it's able to cross the blood-brain barrier and cause the meningoencephalitis. So one thing you will need to know for the test, there's two different versions of meningoencephalitis, both of them amoebic, right? So there's primary amoebic meningoencephalitis called PAM, and then there is the granulomatous amoebic meningitis, which is the other guy, GAM. We're going to talk about him next, but Naegleria fowleri causes PAM. It's rapid destruction of brain and spinal tissue from infection from these guys, and usually once you start having the symptoms, there's nothing really we can do for you, and this is a pretty quick to progress type of thing. Like, this is going to happen pretty quickly. But there aren't very many cases. It's extremely rare. Between 2011 and 2021, so a 10-year span, 29 people were infected from swimming. One person was infected from contaminated water on a slip and slide, and then 3 people were infected using neti pots, using non-sterile water. When I say non-sterile water, I'm talking about tap water here. So these guys can live in your hot water tanks and the pipes in your house. And so if you're using neti pots, please boil the water first before you use it. Let it cool down after you boil it, and then you can use neti pots. I still advocate for a neti pot, especially during allergy season. It helps so much with moisturizing your nasal passages and clearing out any allergens, but be sure you're using isotonic solution. You want to add some proper sodium chloride and sodium bicarbonate for the pH, and you want to be sure that you're using like sterile water, at least boiled tap water. Next is Acanthamoeba, and this guy is associated with the GAM version. So you can get this through conjunctivitis and through keratitis, and that with this progresses, it won't get in from swimming in the warm water. This guy is more commonly associated with like using contact lenses with tap water instead of sterile saline or something like that. Both of these guys, I want to make this very, these are the brain-eating amoebas. The PAM and the GAM ones, both of them have a 97 to 98% mortality rate. And if you survive it, you're almost certainly going to have like defects from it. You don't just survive this and be fine. So this is something that you rarely ever see, but when you see it, it's a death sentence pretty much. Very close to it anyways. All right, so that's it for meningitis and meningoencephalitis. Now, encephalitis. So most of what is left in here is going to be encephalitis. Most encephalitis is going to be viral. And so encephalitis is defined by inflammation of the brain tissue, and the way that that's going to present is by behavior changes, confusion, often caused from the inflammation in the brain, affecting how the brain is functioning. We'll have consciousness issues, you might have passing out, you'll have seizures, and you could potentially also have meningitis develop as well, though it's usually defined by the fact that there is encephalitis. We can treat many of these viral infections with acyclovir. It's like the one broad spectrum antiviral. There's a couple, but like not many as widespread use as acyclovir. All right, so arboviruses are a common cause of encephalitis. These arboviruses are viruses that are transmitted by insect bite. And so this is primarily like viruses that are spread by mosquitoes. And so this would be things like West Nile virus and Zika. Those are like the more common ones that we would know of. But there are plenty of others around the world that can be associated with it, and plenty of other diseases that are spread by these biting insects. And so the biting insects, we can either, whether it's mosquitoes or sandflies or ticks or fleas, whatever it is, can transmit all of these different viral diseases. Not all of them are associated with encephalitis. Some of them are hemorrhagic fevers, which we'll talk about in the next chapter. But there's a lot of diseases that are transmitted by mosquitoes because they're the worst. I feel like all of these are the worst. I hate ticks and mosquitoes. I can't even tell you how much I hate a tick. I think they're the worst. So anyways, mosquitoes, there's a few different species of mosquitoes. So take a look now, and I'm going to mention this. When you start having mosquito, I'm not talking about crane flies, like the big ones that look like mosquitoes, and they're just really annoying and big and fly around. Those crane flies, or I used to call them mosquito hawks, that they're actually associated with like eating other smaller insects. Those are good guys. They're annoying, but they're good guys. But mosquitoes proper. So there's like, if you pay attention this season, you'll see some that are a little bit bigger than others, and the bigger ones like have like a golden body, golden thorax. And then other ones will be black with like white. They're really tiny, but if you look close, black with like white stripes on them. So those are different species. And so we have some of these species like Aedes, and we have Culex, and we have Anopheles mosquitoes. And those guys can basically spread all of these different kinds of disease. I hate mosquitoes. I hate them. I hate all these biting insects. Moving on. Okay. Herpes simplex virus, which we mentioned can cause meningitis, can also cause encephalitis, and maybe even both. Again, this can be herpes simplex 1 or 2 or any other herpes virus, but it's most commonly going to be associated with herpes simplex virus 1 when you have encephalitis. And so this is usually the oral herpes getting transmitted into the eye area. We get cold sores, like 90% of people are going to have HSV1 as just cold sores. It's caused by HSV1. I hate to break it to you, but we probably all have herpes of some kind. Moving on to Zika virus. Zika virus, often when adults are affected with Zika virus, we don't have a ton of signs or symptoms, and they're kind of weird compared to like West Nile or something like that. So when adults are infected with Zika virus, we might not have any symptoms at all, but if you do, it's like joint pains, you might have rashes, you might have conjunctivitis, which is a pretty common side effect of viral infections. But it seems to trigger the immune response against Zika, seems to trigger Guillain-Barré, which is associated with peripheral nerve disease. And so something about attacking the virus causes the immune system to kind of go haywire and cause an attack against the peripheral nerve system. Pregnant women are at risk with Zika virus because virus can cross the blood-brain barrier and affect the developing child, leading to what we call Zika virus syndrome of the fetus. And this would lead to microencephaly, so small brain development, and that would lead to a small head. And you can actually see it in the pictures that they have. Like their head is just way too small compared to the average baby. And this will be a permanent defect. It's not something that you can recover from. Rabies encephalitis. Okay. So rabies can cause encephalitis, but it's usually slow and progressive, but it is a true encephalitis. It's not what we would consider subacute, because once it develops into fulminant rabies, it is a true encephalitis. There's two types of rabies, furious and dumb, and it just depends on that animal's like immune system and how they respond to the virus as to whether or not they're going to get furious or dumb rabies. The furious version is more common, and it's what we consider to be typical rabies presentation. It leads to agitation, disorientation, seizures and twitching. It's all going to be effect of the inflammatory response in the nervous system and affecting the brain and how it functions. It also leads to hydrophobia. Hydrophobia is not actually fear of water. It's going to be the muscles in the throat like violently like contract and cause you to expel the water. You can't swallow. You can't swallow water. You also can't swallow saliva. And what happens is the virus like multiplies in the nervous system and also secretes in the saliva. And so because the animal can't swallow the saliva, they get the buildup in the foaming mouth associated with rabies. and then they can't swallow it, and so it's built up in the mouth. So whenever they get the agitation and they bite, it spreads the disease. So it works in the advantage of the virus spreading through the saliva. Once it gets out of the saliva of that rabid animal and into the new host, let's say it's a person that got bit by a dog, then that virus is going to multiply in the tissue and then move into the peripheral nervous system. Once it gets to the central nervous system, you're done. There's nothing we can do for you. And so if you've been bitten by a rabid animal, you want to get what we call post-exposure prophylaxis. So we will infuse patients that have been bitten and haven't been vaccinated. We'll infuse them with immunoglobulin, which is antibody from people that have had it before, that have people have been vaccinated or something like that. We can get their plasma and infuse you with it. We'll also give you the rabies shot, but we're not going to give it to you the typical way. We're going to give it to you in your gut, because that's where most of your lymphatic tissue is in your gut. And so we give you injections of the vaccine, a series of injections in the gut to just force your immune system to immediately make your own antibodies, because we have got to stop that virus before it gets to your central nervous system. Once it gets to the central nervous system, it's 100% fatality rate. Yes. Mm-hmm. Mm-hmm. Yeah. So did you get the shots immediately after, like pretty much like, so that's pretty early on. So some people don't even realize it, like after they, like if you, the closer you are to a month after. So you usually have a month to 2 months. That's all you get. And so if you are closer to that month, they're going to give you it in your belly. And that's like the old school way of doing things, but definitely is the way they're going to do it if you're the further out you are from the bite. And like getting a week out, you've got plenty of time before it's going to get hard, like, you know, take up house in the central nervous system. But once it gets to that central nervous system, there is literally nothing we can do for you. So, yeah. Well, I mean, if you said that you've been vaccinated, if you've been vaccinated for it, it protects for a while. I think it lasts for a while. So I'm not sure in people, I don't know the exact like regimen for that, but I feel like in people, it's one of those vaccines that you don't have to get very frequently. It's like 10 years or something like that. Um, mhm, mhm. Yeah, so I think, yeah, it'll depend on, yeah, they'll test your titer, your antibody titer, and see if it's still high enough. I mean, most people are going to be protected for a while. It's typical is going to be for a while. And it's also one of those things like if you really thought like that squirrel was probably just defending itself type of a situation. But if it was an animal that you had a reason to suspect that it was probably rabid, like if it's a skunk that you walked out to your car in the middle of the day and there's a skunk that runs up to you and starts attacking to you, like that's probably a rabid skunk, right? Because skunks don't, number one, come out that often in the daytime, or number two, come up to people and attack them, right? Mm-hmm. Yeah. Yeah, almost certainly rabid, right? Because like these animals don't normally approach you in those situations. They're disoriented and they're agitated and things like that. Dumb rabies is whenever you have the progression of the disease pretty much straight into the paralysis phase. You have stupors, a lot of drooling and things like that, but they're not going to be as agitated. And so they usually just slip into a coma. Both phases will eventually fall into a coma and then death will follow because of cardiac and respiratory arrest, because of the nervous system damage that's being done from the disease. This is what the rabies virus looks like. Not going to test you on it, but it is bullet shaped. I feel like it's kind of cool looking. All right, for the epidemiology of this, most of the reservoirs for rabies can infect any mammal ever. So I say any mammal. Possums are not mammals. Possums are marsupials, which are, I guess, a categorization of a mammal because they have mammary glands, right? But they're different class. And so possums have a lower body temperature and can't actually replicate the rabies virus. So possums don't have rabies. That does not make a possum necessarily sterile or something, right? They can carry plenty of other diseases like leprosy and stuff like that. And so, yeah, be aware of that. But they can't have rabies, so that's something. Possums are your friend, by the way. They eat like Armadillos have leprosy for sure. I don't know if they can get rabies, but
Most common outside of
the typical like
run over.
yeah. Skunks. So in Oklahoma, it's skunks and bats are the most common, but obviously things like raccoons. Cats are actually really huge with rabies as well. Ones that are strays, they often aren't vaccinated, and so there's an issue with rabies in cats. Domesticated dogs almost never have rabies. We just don't see it a lot because they're usually vaccinated. So FYI. But in America, not in like other countries, it's a different story. If you're in Mexico City, for example, and there's dogs running around being aggressive, they might have rabies. It's actually not uncommon. So FYI, 35 to 50,000 human cases per year worldwide. In the United States, about 6,000 to 7,000 animal cases. These are the ones that get brought to veterinarians and get diagnosed that way. Usually, if we have an animal that we suspect is rabid, we don't test animals for rabies unless it is requested that they be tested for rabies. And to test for rabies in an animal, we have to remove the brain and the brainstem in order to do tests on that. So like that's after the animal dies. It's 100% fatality rate. So when you suspect an animal has rabies and you're almost sure of it, you're almost always going to be euthanizing that animal. And then you will remove the brain and the brainstem and you can test the tissue. That's the only way we can test for rabies. There's no other way to test for it in animals. That's what I'm saying. Like you cut their heads, like it's a traumatizing experience usually for veterinary workers because you have to remove the head to do it. And it's, yeah, you ask anybody that works in a vet if you're interested, like if it's, it sounds horrific to me. Cut her head off. Yeah. It's terrifying to think about. Horrifying, like nightmares. And like, yes. So that is what I'm saying. It's like every time that I talk about the rabies, I get these stories where I get to hear about people ripping the heads off of animals, and it's just I could not do it. I couldn't do it. Even for me, like bless you guys' hearts that work with animals like that, because I used to volunteer with the Humane Society at their spay and neuter clinic, and just seeing like the animals recovering from the anesthesia was hard for me. Like I can't deal with them actually having a problem. Like that would be too much for me. I don't have the nerves of steel when it comes to the animals, unfortunately. All right, so um, rabies can be transmitted through organ transplant, including corneal transplants. And you can actually take corneas from dead people. Like they don't have to be on life support like other organs do. And you can donate your cornea. And somebody had died from rabies. They didn't know that that's what they had died from, and ended up putting the cornea into somebody else. And that person got rabies and died. So that happened in the United States. Probably. Yeah, like if they, because they usually take the cornea like within, I think, 24 hours after the death, before too much decay would start to happen. So I imagine like after a certain period of time, yeah, the rabies is gonna be deactivated basically from not having living tissue. But yeah, so if you're interested, yes, here in Oklahoma, bats and skunks are the most common carriers. That doesn't mean that raccoons can't have them here. It's just more common to see it in bats and skunks. To prevent rabies, we want to treat as soon as we can after the exposure. You definitely, once you get to the symptom stage, will start having neurological symptoms associated with rabies. There's nothing we can do for you. It's a death sentence after that, quite literally, like no room for exceptions there. The best way to prevent it would be to vaccinate any animals when we have a vaccination effort in place for wild animals as well, which is either literal vaccination if you happen to get trapped for some reason, or we are spreading bait around the United States that has like oral version of a rabies vaccine to vaccinate the wild animal populations. It's working quite well to contain that. So trying to eliminate that. We have a couple of videos to watch on this. We're going to watch an animal version and a human version. For those of you who haven't seen rabies in real life, and I don't mean like old Yeller. Oh my God. I make it, I swear, every class until this. I hope you guys did your taxes. Seems like a normal cat. Yeah. Give it a minute.
Fairly nice, fairly normal.
This cat was normal. It was a stray cat, but it was normal. It was friendly. It would come in. People would feed the stray cats, and then it started becoming aggressive. Now, if you watch how the cat behaves, it can't really ambulate well. It can't walk around well. It's disoriented. So this is the other side of rabies. Well, we talk all the time about the aggression and the biting, but this cat also has the neurological effects of rabies as well. And so all that would be done for this cat would be to put it down. There's nothing we can do. What discussion led to in my Monday morning class, of course, was there's a kindness that we can do to cats or any other animals to spare them the suffering of having to die from rabies, but humans don't get that luxury. If you're a human and you get rabies, you have to suffer through it and die from the rabies because there's no medically assisted suicide in the United States. There are rare circumstances where exceptions will be made for like terminal, long-term, you get a terminal cancer diagnosis, something like that, and the doctor can prove that you're going to suffer and that you are, of sound mind.
Hi.
That sort of stuff.
My name is
No,
Dr. University.
I'm happy to
An
hear
area in
this.
Vancouver, BC.
Great. Let's do the human one. We can get to that ethical discussion if you guys want to, but.
Rabies is one of the most terrifying diseases known to humans. And if the symptoms develop,
We won't
you
watch
need
the,
medical attention or you're going to die.
we might, I don't know, only 2 minutes.
In 1955, this man was attacked by a rabid wolf. The medical team at the Pasteur Institute in Iran filmed the progression of his disease. The medical team could do nothing but document this man's rabies. Within 5 days, he was dead.
The problem with rabies is that unlike most diseases which Mother Nature is merciful in which you lapse into coma or obtunded, with rabies, as you're dying, you are intermittently fully coherent and you can fully express verbally to your family how scared you are, how awful it is, and how you know you're going to die. So for that reason, it's really, really feared.
The thing about rabies is that it affects the nervous system. So it affects the brain, the spinal cord, the thinking parts of a mammal. And it doesn't just randomly wreck those thinking parts, it changes them in a specific way to help the virus succeed. Western medicine has made a lot of progress in fighting rabies. In fact, if you get rabies from an animal, there will be several weeks before you get symptoms, and there's still time in there for medicine to work. But once those symptoms develop, that virus has made its way into your brain. And at that point, medicine may not be able to help you at all.
All right,
When I started drinking warm water to help me lose weight.
I'm sure. Okay.
Warm water.
You hear warm water, you hear cold water. It's just, I'm sick of all of it. All right, so moving on into poliomyelitis, which is the disease that we refer to as polio. This is an enteroviral. Enteric means in the gut. So it gets in through the gut and then moves into the peripheral nervous system, particularly the nerves that control the muscles. You will start off with a fever, headache, nausea, sore throat, and myalgia. Myalgia is basically just feeling like crap. So that should sound pretty familiar. That sounds like the flu, yeah? So you start with flu-like symptoms. Then you'll have development of the neurological symptoms after the virus starts moving into the peripheral nervous system and the nerves of the muscle tissue, and then it can eventually migrate into the spinal cord and the brain as well. We have either the paralytic side of the disease or the bulbar poliomyelitis. Basically, degrees of flaccid paralysis, and it usually is a progressive sort of effect, and then it will start affecting the muscles, but it start moving into deeper muscle tissue as the disease progresses. And it can even affect the diaphragm, so you can no longer breathe. And so your diaphragm becomes paralyzed. So that's why we see people in the iron lungs. They're in this big old machines that have like a bellows on them, and the bellows is literally creating pressure to force the body to take in air. The pressure on the abdomen is forcing air to move in and out. Their people are completely 100% conscious when they have this. They're not in any sort of coma or anything like that. And so you're just awake and waiting to fight off the virus, and you may or may not recover afterwards. So bulbar poliomyelitis. Oh, and there was a guy that just like died last year. It was the last person, like last year or something, the year before, something like that. That was the last person to still be in an iron lung. And he was like in the iron lung for like 70 years and has like 3 PhDs or something like that. Like did better than I've done in my life without being in an iron lung. Yes, and it's literally like when you think of an iron lung, it is like the shoulder pad is. I did not notice it was like that until just now. Anyways, the iron lung is like it's like a hyperbaric chamber, basically, is what it's like. It's like a big like tube, a metal tube that they put you in, and just your head is sticking out. And so the inside of it is pressure increase and decrease inside of the tube to literally force your abdomen to take in air for your lungs, since your diaphragm isn't going to be able to do it for you. And so the pressure. He just, I guess, does it online, or people come talk to him, or I don't know how he did it, but he did it. And so that makes me feel like I'm not accomplishing enough when I have people like this that are out there doing all that, and they're just like in an iron lung. Anyways, moving on. So this can lead to permanent paralysis. And this is a disease that even after you clear the virus, like the inflammatory effects afterwards can actually lead to increasing deterioration of muscle function even after the virus is gone. So literal lasting, the worst aspects of sequelae that we can imagine with disease. It's one of the smallest and simplest viruses that we know of. And it was so tiny that we weren't able to filter it out in our normal like waste control systems. And so we had to put a special waste control system that actually ended up being beneficial for us in controlling COVID, because it was also being transmitted through waste. The way you got polio was by drinking contaminated water. It would get into the gut and then move into the nervous system from there. Humans are the only known animals ever to have polio. And so it is a truly human disease. Vaccines have almost completely eradicated it from the planet. In 1988, the red countries were the ones that had polio. And in 2021, Afghanistan and Pakistan, they still do, even in 2025, have some cases here and there. It's just hard getting into some war-torn areas or to like the small rural areas to get the vaccines out. But the hope is that polio will be eradicated in our lifetime thanks to vaccination. Yeah, if you traveled to Afghanistan or Pakistan, and if people don't want to get vaccinated anymore, there's still risk of it moving back into the human population, potentially mutating, and then no longer being effective with the vaccine, which is the risk with measles as well, right? Let's not forget that that's a thing that viruses do, is mutate. So cross your fingers, everybody. All right, subacute encephalitis. These are slower to progress, and we don't have the typical issues with encephalitis. Most of these guys this is just a really long-term thing. So it's subacute because you either don't have obvious symptoms of it, or it takes a very, very long time for symptoms to present. So toxoplasma and prions are the ones we're going to talk about. Persistent measles infection. If you get measles repeatedly, or you aren't able to get rid of it naturally from your immune system attacking it, then you would be at risk for developing an encephalitis from having measles. Number 1 in 1,000 get life-threatening. That was chickenpox. What was the measles one? There's a figure for that one. Well, 6 million people die from that one. Probably from crap like that, right? So let's move on. Toxoplasma gondii causes subacute encephalitis in some cases. Most people that get infected with this is a protozoa, by the way. This is a protozoa. So most people that get infected with this will not have any symptoms at all, and they would just clear it out of their bodies. And in fact, most people will have had this at some point in their life. So it's a protozoal disease. It is maintained in feline cat populations. It's mostly going to be cats that are going to be transmitting it, and most cats will have it. I think it's like 40% of cats or something have this naturally. And this is why we tell pregnant women not to handle cat litter. And so when you have cat litter, the dustiness of the litter can cause the protozoa to be able to get into like the lungs and things like that. Or you'd be touching it and it could potentially touch your eyes and then it could get into the eyes or something like that. Most of the time, most people don't have symptoms, but if you do, you might have sore throat, swollen lymph nodes, and maybe a low-grade fever. Who's going to think about it? And then normally you'll clear it out of the system. It's only an issue with people who are immunosuppressed. So with people with AIDS, we can sometimes see people that have AIDS, they'll go get a cat and they can actually get toxoplasmosis and die from it, which is something that most normal healthy people would normally not have any issue clearing out. It's not just an issue with people with AIDS, but also people who are pregnant. This guy can cross the placental barrier. If you get toxoplasmosis, and you wouldn't even know because you might not have any symptoms yourself, but there's a 33% chance it'll cross into the fetus, across the placenta. And then we have issues where if it affects the fetus, we have risk of stillbirth, organ problems, hydrocephaly, which is water in the brain, so enlarging of the brain cavity. And then that usually leads to developmental issues that are permanent, convulsions, and can even lead to death after birth as well. So we do not want to have toxoplasmosis. Right. Then we have prion diseases. Prions are misfolded proteins, literally just misfolded proteins. They're a normal protein that has a normal function in the brain tissue, and then it becomes folded the wrong way. It's usually because it sees another misfolded protein that's very similar to it. So we get I don't know how it gets in there from eating it or through medical instruments that have been contaminated with a misfolded protein. They get into the body. They say, hey, I like folding like this. And the good protein that's functioning, doing its job says, hey, I like that way too. It misfolds, and then it causes other ones to misfold. It causes a chain reaction of misfolding of proteins. These misfolded proteins don't do their job anymore, and they're going to stick together and form holes in the brain where they're going to build up. We call those plaques. And those holes are going to form a spongy hole-like structure within the brain. We call this spongiform encephalopathy. So disease of the brain, pathy is disease, encephalo is the brain, and it's sponge-like because we have holes all through it caused by these proteins coming together. And we think that's how this is happening. This is the problem, is that they're just misfolded proteins. The other problem is that these misfolded proteins are very, very hard to get rid of. They really like how they're misfolded, and it's hard to get rid of them even with normal means of sterilization. Autoclaves don't get rid of this stuff. So this is why there's an issue with medical instruments. So you go to the dentist, they might autoclave and sterilize those things, and they'll get rid of HIV, hepatitis, and all those things, but it won't get rid of prions. No normal autoclaving or sterilization procedure will. Not irradiation, nothing. And so the only way to get rid of prions and to get rid of any risk of spreading this from person to person is to use sodium hydroxide, like concentrated, like alkaline, like really alkaline, sodium hydroxide, and then autoclaving at 135 degrees instead of the normal 121 degrees. And that will denature the protein from its very strict, rigid, misfolded shape. So that what happens is we think that you would eat meat that has a misfolded protein, or you would be treated with a medical instrument that has a misfolded protein on it. And again, we don't treat our medical instruments that way. So if somebody has some sort of dementia, but we don't know why they have the dementia, maybe it's from prion diseases. You thought you sterilized this with the autoclave, used it on another patient, and maybe now they're going to, in 30 years, get this. So that's the other thing, is the symptoms and the signs associated with these spongiform encephalopathies take about 30 years to develop. 30 years. So, yeah. Some people might get it within 10 years, as early as a couple of years, maybe tops, but most people it's going to take decades for signs and symptoms to develop. And it presents like dementia at first, and you would have no way to discern it from typical dementia, unless if you got contaminated when you were like 5 years old, and 30 years later you're having dementia, people are going to be asking questions as to why this person has dementia. Because 35-year-olds probably shouldn't, and if it's not running in the family, we might be considering something like a prion disease. It's really difficult to test for this. It's extremely expensive too. Your insurance probably won't cover it. We usually have to take the cerebrospinal fluid, and then it's expensive for the hospital just to like package it and transport it because we're potentially exposing the testing areas of the hospital to the prions. And so we have special procedures that we follow. We had 2 instances of this when I worked at Southwest Integris. It was the same person, and they just couldn't figure out what was causing his brain issues. And he never came back positive with prions, but that was one of the things they tested. And I had to send it off to Los Alamos, which is, a lot of government testing and things like that, but they're the only place that have the ability to test for this. Most of the time, this isn't going to get diagnosed until after death. And so we will perform an autopsy and then look at the brain for that, to look for the spongiform stuff after the person dies. When there was an outbreak of mad cow disease, which is something that I'm old enough to remember that happening in Britain, because they didn't have a lot of land to feed their livestock. In Great Britain, they would feed the cows basically meal made up of dead livestock. And so they would grind dead livestock into a meal and add that as a supplement to the feed, the cattle. And they thought there was nothing wrong with that. Maybe you could think of the ethical reasons of why you think cannibalism might be weird, but they couldn't think of like actually any biological reason. Well, as it turns out, one of the cows may have had a prion disease, and then it spread into the cows that ate it, and then those cows died, and then other cows ate those cows, and it ended up leading to the mad cow disease outbreak in the 90s. They ended up culling huge herds of cattle that they just had to assume had prion diseases, and then that land is now going to be contaminated with the prions because you can't sterilize the land, and et cetera, et cetera. So it created this big thing. And so if you had eaten beef in Europe, basically is how they define it now. If you had eaten Europe beef in anywhere from before like 2000, you can't like donate blood now because we're just going to assume you could potentially have prions, even if you don't have any signs or symptoms, because maybe you will here in a couple of years. I don't know. So yeah, I know. And so that version, the human version of mad cow disease, is called variant Creutzfeldt-Jakob disease, VCJD. So regular Creutzfeldt-Jakob disease is we think it's genetically related, and it seems to be associated with just random mutations that some people will get in their genetic code that makes you predisposed to having your proteins misfold naturally. I don't know anything about this Gerstmann-Streusler-Schanker disease. I know how to pronounce it because I took like 3 semesters of German, but that's as far as I can get with that one. I don't know anything about it. Kuru. Kuru is a prion disease that exists within tribes of New Guinea whenever they would eat the cannibalistic. So they weren't eating people for food or even necessarily for like warring tribes or something. They ate it to venerate their dead. And so they wanted their loved ones to be part of them. And so they saw it as a spiritual practice. But then their loved one died from a prion disease, and then now they would also have prion diseases. Then fatal familial insomnia is a genetic disorder that has something to do with a protein that's associated with sleep. So these are very common. I would say very common. These are the most common, but these are actually incredibly rare. It's just not, we don't see it a lot. So we don't test for it regularly. We don't, prepare for it regularly. Don't see it a lot. Fatal familial insomnia is exactly what it sounds like. You can't sleep anymore, literally ever. It does not matter how tired you get. You won't doze off. You can't sleep anymore, and then you die because you can't sleep. Can you imagine? I just think that would be like a torture. It's a hell of some kind. There's other ones, and in animals, there's one in sheep called scrapie, and then there's one in like deer, in the deer population, especially in the United States. It used to be confined mostly to like Colorado area, but now it's starting to spread all over, and we've had some cases, I think a couple cases in Oklahoma, but you're supposed to, if you hunt deer, have your deer tested for chronic wasting disease. So chronic wasting disease is extremely contagious within deer. Maybe wonder why that deer was the one that you were able to shoot, because maybe it has a prion disease. It's not transmissible to people yet, but there is concern that it does seem to be changing and is now transmissible between other like deer-like animals, and so they're concerned it could potentially spread to people as well. Misfolded protein causes other proteins to misfold. It's hard to get rid of it. Normal stuff won't get rid of it. All right, finally, our last 2 diseases will be tetanus and botulism. These are both caused by bacteria. And so these are bacteria in the genus Clostridium. And so it's either Clostridium tetani that causes tetanus or Clostridium botulinum that causes botulism. And they're kind of 2 sides of the same coin in that they have neurological effects. and they both cause paralysis, but in different ways. In tetanus, any Clostridium, they're all gram-positive endospore-forming rods that are anaerobic. So that's a key characteristic of Clostridium species. They have to get deep into the tissue to become vegetative, and when they're vegetative is when they make their toxins. So in tetanus, the toxin that the Clostridium tetani bacteria make is called tetanospasmin. It's a neurotoxin that makes it so your muscles can't relax. So it constantly makes your muscles be contracted. And so once you contract the muscle, whether it's like to talk or to chew or something like that, is where lockjaw comes from. And so the muscle will stay tight and can't relax it. And it'll be so clenched it can actually break your teeth. So it'll be that strong of a clenching going on. But it doesn't just affect your jaw. It can affect every muscle in your entire body. And eventually can also cause your diaphragm to spasm up like that, and then you can't breathe anymore and you will suffocate and die. Respiratory arrest is usually how people die from this. Your tetanus muscles can actually contract so strongly in the back, it can break your back. And that's how strong these muscle contractions can be in people that have stronger muscles. This is more common. We see this more common in developing countries where they don't have as hygienic of birthing processes. And so normal tetanus might just be present in the environment, the endospores, and it might get into the baby and gets into their GI tract, and then they might develop tetanus when the toxin starts getting made by the vegetative version. It kills approximately 35,000 newborns each year, most of those in developing countries. How do we prevent tetanus? Vaccinations. Vaccines are against the toxoid, which is the part of the tetanospasmin toxin that is associated with creating the symptoms of that seizing up. And that's part of the disease progression. If we can vaccine against that, then you won't get this illness. It's extremely effective, but you need a booster every 10 years. Next is botulism. Botulism is caused by Clostridium botulinum, and its toxin is called botulinum toxin. What happens with this toxin is it blocks the release of acetylcholine. Acetylcholine is the signal that causes your muscles to get the signal to contract, and so it blocks that signal. So you never get the signal to contract. So this is what we call a flaccid paralysis. So tetanus, we get spastic paralysis, seizing up, and in botulism, we get flaccid paralysis. You just can't move the muscle. And this is what we use it for with Botox and migraines and things like that to keep the nerve signals from being sent in local areas. But if this happens throughout the body, again, flaccid paralysis of your diaphragm is not something that you need to be experiencing. So, yeah. Botulism can be contracted in 3 major forms. Foodborne, this is usually where we have canning processes where it creates an anaerobic environment. But botulism is pretty well contained by low pH. That's why pickles and things like that are pretty safe for canning, because it's a low enough acidic pH that it will prevent Clostridium botulinum from being able to grow. One of the biggest foods that's most at risk was like green beans. Green beans are pretty high at risk and that sort of stuff. So vegetables that have been canned that aren't pickled are at a risk for botulism. And that's why they tell you if you have a swelled up can that you should not buy that at the store, because it could be having Clostridium botulinum producing gas and things in there, and that's why it would swell up. Infant botulism, I want to be very clear about this. Clostridium botulinum is like all over in the environment. It's all over the place. And so these endospores can get into like food or milk or something like that, and then once the baby ingests it, that's a nice anaerobic place for the endospores to come to life and start making the toxin. Same thing with the tetanus. It's just which kind of paralysis it's causing. And in wound botulism, it's very similar to like what we saw with gas gangrene, except instead of making the gases and that being the problem, the toxin is the problem with this guy. All right, that is it for this. I'm not going to go over the questions. I'm going to leave these for you guys to go over so that we can just go up to the lab and get that cranking. But if you guys go through the questions, they're pretty straightforward. And if you have any issues with them, let me know. See you guys in the lab.